Hello, this is Mike Nemeth, Communications Director for the California Apartment Association. I'm here to welcome you to today's webinar, COVID-19 Resident Relations Do's and Don'ts. In just a matter of weeks, coronavirus has changed the way Americans live. With shuttered schools, toilet paper shortages, canceled events, and more, we're living in strange and anxiety-inducing times. At the rental property, you likely have lots of questions as you seek the right way to respond to COVID-19. To help you navigate the outbreak, we have two presenters with us today. Stephanie Shirkey, the California Apartment Association Senior Policy and Compliance Counsel, and Whitney Prout, the association's Legal and Compliance Counsel. In this webinar, Stephanie and Whitney will discuss a number of do's and don'ts for things like communicating with residents about COVID-19, reducing transmission risks in the common areas, and handling resident requests. Before we get started, I have a legal disclaimer to share. CAA strives to provide accurate and timely information to assist its members. This seminar offers general information only and is not intended as legal or medical advice. For legal advice on your specific property, please contact an experienced attorney. For medical advice, please seek the advice of your physician or another qualified healthcare provider. Information presented in the seminar is subject to change and is protected by copyright. Stay tuned and keep informed with CAA. Now I'd like to turn over the webinar to Stephanie.
Thank you, Mike. So most of the concerns that have been raised regarding COVID-19 have been practical: how to prevent transmission, what to do if you suspect you are sick, etc. And we will discuss some of those today. But there are a couple of areas where housing providers have special obligations they need to be aware of, and of restrictions on evictions of tenants that are being put into place. Those obligations and restrictions will be our focus in this webinar.
That's right, Stephanie. And for more information about the practical aspects of dealing with the novel coronavirus, CA will be offering another webinar that includes a roundtable discussion by industry professionals regarding different operational adjustments being made by some in the industry. So stay tuned for that.
So let's start with some guideposts for communicating with residents about coronavirus. We'll start with the things you can do if you choose. These aren't mandatory steps, but are options you can choose to exercise if you so choose to. First, do feel free to share the materials that the CDC and other public health organizations have put together. The CDC in particular has created fact sheets that can be distributed and posters that can be put up that explain what coronavirus is and how to help prevent its spread. Along those same lines, if residents ask you questions about the coronavirus, you can certainly direct them to those public health resources such as the CDC. At the end of the slideshow, we will have a list of helpful websites.
And in addition, feel free to share with your residents about what you're doing at the property to help reduce the risk of the virus spreading at your property, such as deep cleaning common areas and providing hand sanitizer stations, if you can find hand sanitizer in the stores. But the reason I emphasized the word facts takes us to our first on the don't list. Don't make representations about the property's risk level. In other words, you can't promise that a resident or their guest won't be exposed to the virus at the property, even if you are hypervigilant about disinfecting and social distancing. So it's best not to falsely make people think you can.
So Whitney, I get that you don't want to minimize the risk that residents might face, but what about making sure residents are informed about heightened risks they might face? Can you ask tenants about whether they have been exposed or tested positive? What if a resident tells you they have tested positive? Can you tell the other residents in the building so they can keep their distance?
Well, the short answer to both of those questions is no. So most landlords know that under fair housing laws, outside of very limited circumstances, you can't ask a resident if they're disabled or about the details of their disability. What many people don't realize is how broadly disability is defined. So while the actual definition is quite long, I'll just shorten it here. Suffice it to say that having a coronavirus infection would almost certainly be considered a disability under California law. And just as you can't ask a resident about a disability, you can't violate the resident's privacy by sharing information about their disability, again, including a coronavirus infection, when they have chosen to share that information with you.
And so I assume that wraps into our last don't, not to treat residents differently because you know or suspect they are sick.
Yeah, that's right, Stephanie. So just as we discussed before, being sickened by the coronavirus would be considered a disability under California fair housing laws. And so just like with any other disability, you can't treat a resident differently because they're sick, which actually brings up another little known provision of fair housing law, which states that it's also considered discrimination to treat someone differently because you regard them as having a disability. In other words, if you suspect someone is sick, but you don't actually know that for a fact, it would still be considered a fair housing violation to treat that person differently based on your suspicions, even if it turns out they weren't sick. And so on the last slide, we said that landlords can communicate with their residents about the steps they're taking to reduce the risk of the virus spreading at the property. But Stephanie, what are some of those actual steps they can take that they would then be communicating with their resident about?
Yeah, so these are really just the steps that the CDC has recommended. Clean and disinfect frequently touched objects and surfaces. The CDC has specific guidance on how to clean and disinfect. They have stated that diluted household bleach solutions, alcohol solutions with at least 70% alcohol, and most common EPA registered household disinfectants should be effective. Also practice social distancing and encourage residents and employees to do so as well. Social distancing measures the CDC has identified include limiting large gathering, increasing physical space between individuals.
And Stephanie, that word encourage is really key. So stepping over to the don't column on this slide, don't try to regulate your residents' private conduct, such as telling them that, handshaking is banned at the property or mandating that they have to stay inside their units. Likewise, while you're certainly free to clean and disinfect common areas, you don't have the right to enter a resident's unit and demand that you're going to disinfect their unit. And likewise, you can't require the resident that they do a thorough disinfection of their unit either.
So the coronavirus has caused an unprecedented disruption in the US economy, with many people having their hours at work cut or having to take time off work because their children's school was closed. So what does that mean for landlords trying to collect the rent and enforce the lease?
Well, the first thing to say is that this is an area that is rapidly developing. We're seeing, new guidelines and directives coming up every day. And I know, Stephanie, you're going to talk about that in just a minute. But there's one thing that's actually a long-standing rule that folks might not be thinking about amid all of the panic around this coronavirus. And that is, again, because the coronavirus infection is considered a disability under fair housing laws, like we discussed before, that means a resident can actually request reasonable accommodations from generally applicable rules and policies due to that disability. So for example, a resident who's unable to work because they're sick with a coronavirus infection might pay rent late because it took time for their disability benefits to kick in. And they might ask you to waive a late fee as a reasonable accommodation. Whether or not to grant that request is something you have to consider on a case-by-case basis. But the key here is that you do at least have to consider it rather than rejecting it out of hand. There are specific guidelines for reasonable accommodations and what you can and can't consider that are beyond the scope of this webinar. But again, know that you do have to consider that, and we absolutely recommend working with an experienced fair housing attorney if you do face a request for a reasonable accommodation from a resident.
Yeah, and in addition to that case-by-case basis consideration of reasonable accommodation requests, landlords also need to be aware that cities all over the state are expected to adopt temporary statewide measures banning evictions of those affected by the virus, and there's also now talk of a statewide measure. So before serving any eviction notice, including a 3-day notice to pay rent or quit, it's important to check on the status of any such bans that may affect the property. This is also why it's important that you do keep the lines of communication open with your tenants.
Yeah, absolutely, Stephanie. And so all of our listeners know CAA will be providing more information about these temporary measures, both at the local level and if something does materialize at the state level on our website and sending out member communication. So definitely stay tuned for that. And of course, if you do find yourself in a situation where you think you may need to move forward with an eviction process, now more than ever, absolutely be seeking legal counsel before doing that so that you avoid running afoul of any of these special restrictions that are being considered and put into place.
All right, so that brings us to the end of this webinar. For more information about how the coronavirus is affecting the rental housing industry specifically, keep checking back at caanet.org/coronavirus.
Yes, and as promised earlier, if you're looking for more general information about coronavirus and the latest developments on the public health front, you can visit the CDC, the Centers for Disease Control, and World Health Organization websites. You can see those listed on the screen, and they have lots of great resources and information about the coronavirus. So thank you for your time today, and stay safe and be well.